Have you ever felt like this before? You are told you have recovered, the test results look better, yet your body does not quite feel the same. One of my patients once shared this with me. She said, "Doctor, they told me I was fine, but I still feel slower, more tired, and a little foggy." I want you to imagine this. You reach the end of a long road, only to realize it is not an ending, but a quiet turn into something new. I am Dr. Evelyn Carter, and I have spent decades caring for older adults here in the United States. What I have learned is simple but important. Recovery does not always mean the journey is over. For many seniors, especially after serious infections, healing continues long after the word recovered is used. Today, we are talking about Nipah virus long-term health risks, not to create fear, but to bring understanding. In medicine, there is a difference between test results returning to normal and the body truly regaining strength, balance, and clarity. Blood work may improve, scans may look reassuring, yet the brain, nervous system, and immune system often need more time to settle and repair. As we grow older, recovery naturally slows. The brain processes information more carefully, the nervous system becomes more sensitive, and the immune response is less flexible than it once was. This is not weakness. It is simply how the body protects itself with age. That is why some older adults notice lingering fatigue, changes in memory, or emotional sensitivity even after infection has passed. I want to reassure you, not everyone will experience long-term problems. Many people recover well, but understanding Nipah virus long-term health risks helps you listen to your body with patience instead of worry. Knowledge allows you to notice changes early, speak calmly with your doctor, and care for yourself with confidence. If this conversation feels helpful, please take a moment to like this video, share it with someone you love, and subscribe to Senior Health Daily. Your support allows us to continue creating calm, trustworthy guidance made especially for you. In the next part, we will gently explore what long-term health changes may look like and how to approach them without panic, only clarity and care. Why symptoms can return after recovery. When someone is told they have recovered, there is often an expectation that life will immediately return to normal. I have seen this hope many times in my exam room. A patient smiles with relief when the tests look better, yet weeks later they return with a quiet concern. They say they feel more tired than before, their thinking feels slower, their balance is not quite steady. This can be confusing and sometimes frightening, especially for older adults who believed the hardest part was already behind them. What I often explain is that recovery has layers. Clearing an infection does not always mean the body has finished repairing itself. Viruses like Nipah can place stress on the brain, the nervous system, and the immune response. These systems are deeply connected, and they recover at different speeds. In younger bodies, this adjustment can happen quickly. In older adults, it often takes longer because the body prioritizes protection over speed. I remember one gentleman in his early 70s who told me he felt fine for a short while after recovery, only to notice weeks later that his energy dropped suddenly. He was frustrated because he thought something new was wrong. After careful evaluation, it became clear that his nervous system was still settling. The infection was gone, but the body was recalibrating. This delayed response is not unusual. It is the body continuing its work quietly in the background. From a simple scientific perspective, inflammation does not always disappear the moment an infection clears. Low-level inflammation can linger, especially in the brain. This can affect memory, sleep, mood, and coordination. Older brains are more sensitive to these changes, which is why symptoms may appear later rather than sooner. This does not mean damage is inevitable. It means the healing timeline is longer and less predictable. I want you to hear this clearly. The return of symptoms does not automatically signal decline. It often signals recovery in progress. The body is asking for patience, rest, and gentle attention. When seniors understand this, fear tends to soften. They stop pushing themselves too hard and start listening more carefully. This understanding is the foundation for everything we will talk about moving forward. When we recognize that delayed symptoms are part of the healing story for many older adults, we create space for compassion. We also create room for better conversations with doctors, caregivers, and loved ones. Healing does not always announce itself loudly. Sometimes it arrives slowly, one quiet adjustment at a time. Brain health changes over time. One of the most common concerns I hear from older adults after recovery is not about pain or fever, but about the mind. People tell me they forget small things more easily. They lose their train of thought in conversations. Reading feels harder than it used to. These changes can be subtle, but they matter deeply because they affect confidence and independence. The brain is especially sensitive after a serious infection. Even when the virus is no longer present, the brain may continue adjusting for months. This is because infections can temporarily disrupt how brain cells communicate with one another. Think of it as background noise that takes time to quiet down. For seniors, that quieting process is slower, not because the brain is failing, but because it is being careful. I once cared for a woman in her late 60s who described her mind as feeling tired. She could still manage her daily life, but tasks that once felt automatic required more focus. She worried this meant something permanent was happening. What helped her most was understanding the difference between normal age-related changes and temporary stress on the brain caused by illness. Aging already brings gradual shifts in memory and attention. An infection can temporarily magnify those shifts, making them feel more alarming than they truly are. From a simple scientific view, the brain relies on steady blood flow, balanced chemicals, and low inflammation to function well. After infection, inflammation can linger at low levels. This can slow processing speed and affect short-term memory. In older adults, the brain often compensates by working more deliberately. That slower pace can feel unfamiliar, but it is often a sign of adaptation rather than loss. It is important to say this clearly. Experiencing changes in memory or concentration after recovery does not automatically mean cognitive decline. Many of these changes improve gradually as the brain settles. What matters most is noticing patterns over time rather than focusing on one bad day. Everyone has moments of forgetfulness. Stress, poor sleep, and worry can all intensify these moments. I encourage seniors to treat their minds with the same patience they offer their bodies. Gentle routines, regular sleep, meaningful conversation, and mental rest all support recovery. When fear enters the picture, it often worsens symptoms. Calm understanding does the opposite. It allows the brain to heal in its own time. By recognizing how recovery and aging can overlap, older adults gain reassurance. They stop viewing every change as a warning and start seeing it as information. This perspective helps protect emotional well-being and strengthens trust in the healing process. Neurological complications explained simply. When people hear the words neurological complications, their minds often jump to the worst possible outcomes. I understand that reaction. Over the years, I have learned that fear usually comes from unfamiliar language rather than from what is actually happening in the body. My goal here is to make this topic feel understandable and grounded, not alarming. The nervous system is the body's communication network. It helps you move your muscles, maintain balance, feel sensations, and think clearly. After a serious infection, this network can become temporarily irritated, much like a phone line with static. Messages still get through, but not as smoothly as before. This is often what people are experiencing when they notice tingling, mild weakness, shakiness, or changes in coordination. I remember a patient who described feeling slightly unsteady when walking, especially in the morning. She feared this meant permanent damage. What we found was that her nervous system was still adjusting after illness. With time, gentle movement, and reassurance, her balance gradually improved. Her body was not breaking down, it was recalibrating. From a simple scientific perspective, infections can leave behind low-level inflammation that affects how nerves send signals. In older adults, nerves recover more slowly because the body prioritizes stability and safety. This slower recovery can feel like something is wrong, when in reality, the system is being cautious. Think of it as the body lowering its volume to avoid overload while it heals. It is also important to know that not every unusual sensation is a complication. Fatigue, stress, and disrupted sleep can all affect how the nervous system behaves. When someone is tired or anxious, nerves become more sensitive. This can create sensations that feel new or uncomfortable, but are not dangerous. What helps most is paying attention to patterns. Are symptoms improving slowly over time, even if not in a straight line? Do good days still exist? These are encouraging signs. Sudden or severe changes should always be discussed with a doctor, but mild, fluctuating symptoms are often part of recovery. I want older adults to feel empowered rather than frightened. Understanding the nervous system in simple terms allows you to respond calmly. When you reduce fear, the nervous system often settles more easily. Healing is not only physical, it is emotional as well. By replacing scary words with clear understanding, we create the conditions for steadier recovery and greater peace of mind. Emotional and mental health. After infection. After recovery, many older adults tell me that the hardest changes are not physical. They describe a quiet anxiety that lingers without a clear reason. Others feel mentally drained, as if their emotional energy has been used up. Some say they no longer feel fully in control of their thoughts or reactions, even though nothing obvious has changed in their daily life. These experiences can be unsettling, especially for people who have always been emotionally steady. Illness places a heavy load on the mind. During infection, the body stays in a state of alert, constantly monitoring for danger. When the illness ends, that alert system does not always switch off right away. For some seniors, it remains partially active, creating feelings of worry, restlessness, or unease. This is not a sign of weakness. It is the nervous system trying to protect itself after stress. Mental fatigue is also common. Thinking, making decisions, and concentrating can feel more exhausting than before. This happens because the brain has been working harder during illness and recovery. In older adults, the brain naturally conserves energy by slowing down after stress. While this is protective, it can feel like a loss of sharpness or motivation. There is also the emotional impact of uncertainty. Many seniors value routine and predictability. Infection disrupts both. Even after recovery, the fear of setbacks or new symptoms can create a sense of lost control. I've seen patients who become hyper-aware of every sensation in their body, interpreting normal fluctuations as threats. This constant monitoring increases anxiety and keeps the mind from resting. From a simple scientific standpoint, stress hormones often remain elevated after illness. These hormones affect sleep, mood, and emotional balance. Older adults are more sensitive to these changes because their systems adjust more slowly. At the same time, many seniors have lived long enough to remember serious illnesses from the past, which can intensify fear when health feels uncertain again. What I always emphasize is this: emotional changes after infection are common and understandable. They do not mean someone is failing to cope. They mean the mind is healing alongside the body. Calm reassurance, predictable routines, gentle social connection, and rest all support emotional recovery. When seniors are told that these feelings are part of the process, something important happens. Fear loosens its grip. Emotional balance begins to return. Healing becomes less about fighting symptoms and more about allowing the mind to feel safe again. Physical strength and daily function. Many older adults notice that their bodies feel different after recovery, even when medical tests show improvement. Simple tasks that once felt effortless may now require more energy. Walking longer distances feels tiring. Standing up from a chair takes more focus. Balance may feel less reliable, especially in the morning or at the end of the day. These changes can be frustrating and sometimes discouraging. Physical strength and coordination rely on a delicate partnership between muscles, nerves, and the brain. During illness, that partnership is interrupted. Muscles may weaken slightly from reduced movement. the nervous system may send signals more cautiously. The brain may prioritize safety over speed. Together, these shifts can make the body feel less steady, even though no single part is seriously damaged. I often think of one patient in her early 70s who told me she felt as though her body had lost its rhythm. She was still capable, but everything felt slower. What helped her most was understanding that recovery does not move in a straight line. Strength returns gradually, often in small steps that are easy to overlook. Expecting the body to bounce back quickly can lead to overexertion and setbacks. From a simple scientific view, muscle mass naturally decreases with age, and recovery after illness accelerates that process temporarily. Balance also depends on sensory input from the inner ear, vision, and nerves in the feet. After infection, these systems may be slightly out of sync. The body responds by moving more cautiously. This caution can feel like weakness, but it is often a protective response. Patience is essential because the body needs time to rebuild trust in itself. Gentle, consistent movement supports this process far better than pushing through fatigue. Rest is not laziness, it is part of healing. When seniors respect their limits, they often regain function more steadily and with fewer setbacks. I encourage older adults to measure progress in realistic ways. Are daily tasks becoming easier over time? Is confidence slowly returning? These are meaningful signs of recovery. Caregivers and family members also play an important role by offering encouragement without pressure. Understanding why physical strength and balance change after recovery helps reduce frustration. It shifts the focus from what has been lost to what is slowly returning. With patience, kindness toward the body, and realistic expectations, many seniors find that daily function improves. Healing is not about rushing forward. It is about moving steadily, one safe step at a time. At this point in our conversation, I want to pause for a moment and speak to you directly, not as a presenter, but as someone who has sat across from many older adults in quiet exam rooms. When people reach this stage of recovery, they often tell me that what they need most is not more urgency, but reassurance. They want to know they are not alone in what they are feeling, and that their questions are reasonable. I have learned over the years that understanding your health changes the way your body responds to them. When fear is reduced, the nervous system settles. When uncertainty softens, healing feels more manageable. That is why these conversations matter. They are meant to slow things down, not speed them up. Many viewers find this channel during moments of uncertainty. Perhaps you are listening late at night or early in the morning, wondering whether what you are experiencing is normal. Maybe you are a caregiver, quietly trying to support someone you love while managing your own worries. If this video has given you clarity or even a small sense of calm, that tells me we are doing something meaningful together. I want to share this with you gently and honestly. I'm Dr. Evelyn Carter from Senior Health Daily. If this video has helped you better understand your health, please consider subscribing, liking, and sharing Senior Health Daily. Your support truly encourages us to continue creating calm, helpful, and trustworthy health content made especially for you. Support is not just about numbers. It is about building a space where older adults feel respected, informed, and understood. When you subscribe or share, you help this message reach someone else who may be searching for reassurance rather than alarm. What matters most to me is that you feel seen and heard. Healing is not only physical, it is emotional and relational. Knowing that others are walking similar paths can make a difficult season feel lighter. As we continue this conversation, I invite you to stay present with your own body and mind. Notice what feels reassuring. Notice what feels grounding. Understanding grows best in a calm environment, and that is what we aim to offer here. The role of routine and familiar habits. As recovery continues, one of the most powerful supports for healing is something many people overlook. It is routine. For older adults, familiar daily patterns are not simply habits. They are anchors that help the brain feel safe. After illness, especially one that has disrupted both body and mind, the brain looks for signals of stability before it can fully relax. The aging brain relies more heavily on predictability. This is not a limitation, it is a strength. Familiar routines reduce the amount of mental effort required to get through the day. When the brain knows what comes next, it can conserve energy for healing and repair. After infection, this becomes especially important because the brain has already been working overtime. I have seen this repeatedly in my practice. Patients who return to gentle, familiar routines tend to regain confidence more steadily than those who try to change everything at once. One woman told me that simply returning to her morning tea ritual helped her feel like herself again. The body did not change overnight, but her sense of grounding did. That sense of grounding matters more than many people realize. From a simple scientific perspective, routine lowers stress hormones. When stress hormones remain elevated, the brain stays alert and reactive. Familiar patterns tell the nervous system that the environment is safe. This allows the brain to shift from protection mode into recovery mode. In older adults, this shift takes time and repetition. Sudden changes, even well-intentioned ones, can feel overwhelming and slow progress. Familiar habits also support memory and focus. Repeating known activities strengthens existing neural pathways rather than forcing the brain to create new ones during a vulnerable period. This is why I often encourage seniors to keep daily structures simple and consistent while healing. There is no rush to reinvent life after recovery. Caregivers sometimes feel pressure to introduce new routines or activities to speed improvement. While movement and engagement are important, they work best when built on what already feels comfortable. Small, familiar steps create a sense of control that illness often takes away. Routine is not about rigidity, it is about reassurance. It allows the brain to rest within known boundaries. When older adults understand this, they stop blaming themselves for needing structure. They begin to see routine as a tool for healing rather than a sign of decline. In recovery, stability is not standing still. It is creating a steady foundation. From that foundation, strength and confidence can grow naturally, at a pace the body can sustain. Recovery is rarely a journey taken alone, especially for older adults. Family members and caregivers often notice changes before the person experiencing them does. These observations are not about searching for problems, they are about understanding patterns and responding with care rather than alarm. One of the most important things families can watch for is consistency. Occasional forgetfulness, fatigue, or low mood is common during recovery. What matters more is whether these changes are slowly improving, staying the same, or becoming more frequent. Subtle shifts in routine, such as sleeping longer than usual, withdrawing from conversations, or losing interest in familiar activities, can offer valuable information. These signs do not automatically mean something is wrong. They simply signal that the body and mind may still be adjusting. I often remind caregivers that older adults do not always express discomfort directly. Many try to protect their families by minimizing symptoms. This is why gentle observation matters. Noticing changes in walking, posture, or balance can be just as important as noticing changes in mood or memory. Again, patterns over time are more meaningful than single moments. Patience plays a central role in recovery. From my experience, pressure to return to normal too quickly often creates setbacks. When seniors feel rushed, their stress increases, and symptoms can worsen. Calm reassurance helps the nervous system settle. Simple phrases like, "take your time," or "there is no hurry," can have a powerful effect. Caregivers also need to care for themselves. Supporting someone through recovery requires emotional energy. When caregivers are exhausted or anxious, that tension can transfer to the person they are helping. Taking breaks, asking for support, and maintaining personal routines are not selfish acts. They are part of effective care. It is also important to know when to speak up. If changes become sudden, severe, or concerning, reaching out to a healthcare professional is always appropriate. Clear communication helps ensure that medical guidance is timely and balanced. Above all, families should remember that recovery is not a performance. There is no deadline. Progress often comes quietly and gradually. When caregivers approach recovery with patience, curiosity, and compassion, they create an environment where healing feels possible. Their calm presence becomes a steady guide, helping older adults regain confidence one day at a time. Monitoring without panic. One of the challenges I see most often after recovery is the tension between staying aware and becoming overwhelmed. Many older adults want to do the right thing. They want to notice changes early and protect their health. At the same time, constant monitoring can create anxiety that makes symptoms feel worse. The goal is not to watch every sensation, but to observe health with calm intention. Smart monitoring begins with understanding what is normal for you. Recovery can include good days and more difficult days. This variation does not automatically mean something is wrong. I encourage seniors to look for trends rather than isolated moments. Is energy slowly improving over weeks? Is balance becoming more reliable over time? These gradual shifts are often more meaningful than daily fluctuations. Simple tools can be helpful. Keeping a short daily note about sleep, mood, and energy can provide perspective without obsession. This is not about recording every detail. It is about noticing patterns. When people write things down briefly, they often realize that progress is happening even when it feels slow. Knowing when to ask a doctor is also important. I always tell patients that sudden changes deserve attention. New weakness, confusion, severe headaches, or a noticeable decline in daily function should never be ignored. These situations call for professional guidance. On the other hand, mild symptoms that come and go, especially when improving overall, are often part of the healing process. One of the most reassuring things a doctor can do is explain what to watch for and what to expect. When seniors understand this, they feel less afraid of missing something important. Fear tends to rise when expectations are unclear. Clear information brings calm. From my experience, the healthiest approach is partnership. Monitoring is not about controlling the body. It is about listening to it with respect. The body communicates through patterns, not through constant alarms. When you respond with curiosity instead of fear, the nervous system remains steadier. Caregivers can support this balance by asking open, gentle questions rather than pressing for constant updates. A calm tone often leads to more honest communication. When pressure is removed, people are more likely to share what they are truly experiencing. Healing is supported by awareness, not vigilance. By monitoring health thoughtfully and knowing when to seek guidance, older adults protect both their physical well-being and their peace of mind. This balance allows recovery to unfold without unnecessary stress. Living well after infection. As recovery continues, many older adults begin to ask a different kind of question. Instead of asking when they will feel exactly like before, they ask how to live well now. This shift in perspective is important. Healing is not about racing back to an earlier version of yourself. It is about learning how your body wants to move forward. Living well after infection often means slowing down in thoughtful ways. Slowing down does not mean giving up. It means paying closer attention. The body speaks quietly during recovery. It communicates through fatigue, comfort, appetite, and mood. When seniors listen without judgment, they make choices that support healing rather than pushing against it. I have watched many patients regain strength by honoring this slower pace. One man told me he stopped measuring his days by how much he accomplished and started measuring them by how steady he felt. Over time, his confidence returned. His body responded positively to consistency instead of pressure. This approach allowed recovery to unfold naturally. From a simple scientific view, the body heals best in a calm environment. Stress hormones interfere with repair processes. Rest, regular sleep, gentle movement, and emotional safety create conditions where the immune system and nervous system can stabilize. For older adults, these conditions matter even more because healing pathways are more sensitive. Recovery is best understood as a journey rather than a deadline. There will be days that feel encouraging and days that feel discouraging. Neither defines the outcome. What matters is the overall direction. When seniors expect variability, they are less likely to feel defeated by temporary setbacks. Listening to the body also means respecting new boundaries. These boundaries may change over time. What feels right today may feel different in a few months. Flexibility allows the body to adapt without fear. There is no failure in needing rest. Rest is an active part of healing. I often remind people that wellness after infection includes emotional well-being as much as physical strength. Enjoying small routines, connecting with others, and finding moments of calm all support recovery. Life does not have to be large to be meaningful during this season. Living well after infection is about partnership with your body. It is about patience, trust, and kindness toward yourself. When seniors embrace recovery as a journey, they often discover a deeper sense of balance than they expected. Healing becomes not just a return, but a gentle transformation. As we come to the end of our time together, I want to thank you for staying with me through this conversation. Listening all the way through already shows care and courage. It tells me that you are someone who wants to understand your body rather than fear it. Learning about Nipah virus long-term health risks is not meant to create worry. It is meant to give you a steady sense of direction. When we understand what recovery can look like, we stop blaming ourselves for needing time. We stop rushing a body that is doing its best to protect and repair itself. Knowledge, when shared gently, becomes reassurance. One of the most important lessons I have learned as a physician is this: the aging body heals best when it feels respected. Healing does not respond well to pressure or impatience. It responds to trust, consistency, and kindness. When you allow yourself to move at a pace your body can manage, recovery often feels more stable and less frightening. I also want to honor the caregivers and family members who walk beside older adults during recovery. Your patience matters more than you know. Your calm presence creates safety. Your willingness to listen often heals more than words ever could. Senior Health Daily was created to be a place you can return to when health questions feel heavy. Not for urgency, not for alarm, but for steady guidance you can trust. A place where understanding replaces fear and patience replaces pressure. If this video brought you clarity or comfort, I invite you to stay connected with us. Follow Senior Health Daily and continue this journey with us. Together, we will keep choosing calm, compassion, and confidence as we move forward, one steady step at a time.